Hi everyone, I'm Dr. Rohit Arora. I'm a pediatrician and neonatologist at Apollo Cradle Hospital, Gurgaon. Uh, as we all know, the International Breastfeeding Week is approaching. It's celebrated all across the globe in the first week of August, and that's why we have gathered here the esteemed bunch of pediatricians and the obstetricians and gynecologists who better can address any queries related to the breastfeeding. Right. Thanks to Voice of Healthcare to provide this platform and opportunity so that we can discuss and take it further from here. Now, last year actually provided a unique challenge in terms of COVID, right? We do celebrate Breastfeeding Week every year on this more or less similar lines. Right? We discuss how to promote breastfeeding, what all challenges we face, and how to resurrect them. But then last year, probably even few months before that, more than 1 year, we have been facing this unique challenge, COVID situation, right? So COVID is there, and we all have been affected somehow or the other by it, and no more than the pregnant mothers and the pregnant women and then lactating breastfeeding mothers. So there have been a lot of questions and queries coming up. I'm sure all the panelists are also experiencing these queries coming from the families as to related to breastfeeding and how to tackle in when there is COVID or when COVID is around, if not in the mother, in the family. So we'll try to answer some of these queries in a question answer format, and we have expert panel available. Maybe we can introduce one by one as we move along the questions, right? So I'll start off my first question from Dr. Ravneet. Maybe Dr. Ravneet can introduce herself, and then the question I'm throwing at her is that is it safe for a mother to breastfeed if she is infected with coronavirus? Dr. Ravneet, please.
Thank you, Dr. Rohit. Thank you, team, for giving me this opportunity today to be with you. I'm Dr. Ravneet Joshi. I am MD Pediatrics and I've done my IBCLC, so I deal exclusively with the human lactation as a part of my practice. And first question, what Dr. Rohit asked that whether it is safe to feed during COVID-19 if mother is suspected or infected with COVID-19. Yes, COVID-19 does not get transmitted via breast milk. In fact, via breast milk, mother will be passing certain antibodies via her breast milk to the baby. So baby will be naturally protected against infections, and that include even protected against COVID-19 infection. So mother can safely feed the baby by using certain precautions, and these precautions are wearing a medical mask. She should wash her hands with soap and water prior to feeding, or she can use any alcohol-based sanitizer. She should frequently clean the surfaces she's in touch. Now, she does not need to clean each time the breast area unless she coughed on the breast area. In case she has coughed on, then she can clean the breast area with just normal water, and that's it. If the mother has fever and she finds herself in the position where she's too tired and she cannot feed directly, she can always express, and that milk can be given to the baby via the caretaker. And this milk storage life I will discuss in detail. You can store this express milk 4-hour room temperature, 2 days in the fridge, so she can do at her convenience. And the breast milk is extremely important during COVID-19 situation. It really will protect your baby from getting infected. So please continue breastfeeding. It is liquid gold at this time. Thank you.
Yeah, perfect. Yeah. The answer is that mothers should breastfeed whether COVID or not, right? So that's the consensus so far all across, and it's probably the most common question which is being asked to all of us, right? So yes, it should be unequivocally that mothers should continue to breastfeed irrespective of the COVID status. Thank you. Thanks, Dr. Ravneet. All right. I'd like to welcome Dr. Astha here. And the question
And the
for her
question for
is,
her
is it safe
is
for
it
the
safe
mother
for
to
the
get
mother to get
vaccinated for polio
vaccinated for polio
while she is
while she
breastfeeding?
is breastfeeding? Hi, I'm a consultant in gynecology in Gurgaon. And yeah, so as you mentioned, this is a very common question which I get asked from all my patients. So the government of India has recently now recommended the COVID vaccine in pregnancy and breastfeeding. Initially, there were some doubts because it's a new vaccine. We still don't know about the long-term consequences of these vaccines. But since it has been approved for emergency use and we've been using it for 2 years and we have not seen any side effects of the vaccine, so it has been approved. But we do offer a full risk benefit analysis to all our patients. So which includes the risk which they could be having of getting a coronavirus, and we've seen in the last wave which had such a high transmission that people who were sitting in their homes also could catch it. So everybody is at risk, and we also know that another wave is possibly coming. Then the third thing is that the vaccine has been shown to be effective, and we have actually protected ourselves because of the vaccine, and the vaccine has been able to prevent severe disease. So it is important that everybody, so if we do a risk benefit ratio analysis, then obviously the benefits are far outweighing the risks. The side effects that we've just seen are just a little fever and a little malaise after the vaccine. Though we don't have any long-term studies on the effects on the fetus, but whatever studies have happened till now have been promising. So it is recommended that people take the COVID vaccine and protect themselves.
Okay, great.
Okay,
Yeah.
great. Yeah.
Yeah.
And another point, sorry, as probably provide some antibodies to the baby. Although there are some studies ongoing, it's not like a proven this thing, but IgA and IgG antibodies could be have been found in the breast milk in women who had been vaccinated. So.
Yeah, perfect. Yeah, so as you mentioned, Dr. Astha, the studies which were initially designed, which actually were not designed to include pregnant women, but by default, a lot of females who got the shots and later were found to be pregnant, right? And they are doing pretty well afterwards. So, surrogately, you can say that it was pretty safe. So, from that data, which was a quite a decent cohort, when I went through that data, it was quite a big numbers. So it now consensus is being formed that it's quite safe to give during pregnancy as well as lactation. Now, just a side question, Dr. Asta. Any particular trimester where you would want to prefer any particular trimester? All trimesters you can give vaccine.
Certain pregnancy. So the government guidelines say that whenever you're taking a flu shot, you should have a 2-week gap from that if you're taking a COVID vaccine. But personally speaking, we generally don't prefer giving vaccines in the first trimester. Even the flu shot we give after 12 weeks. So if possible, I recommend my patients to take it after their first trimester. Although these are inactive vaccines and they're component vaccines, so theoretically they're safe to be taken anytime.
All right.
All right.
Perfect. Yeah. Thank you. I'd like to invite Dr. Anusha now, and maybe she can introduce and herself. And the question for her is: there are now multiple variants of the virus, and possibly more yet to be discovered. Is there any specific variant that may carry a potential threat to pregnant and lactating mothers? We hear about Delta variant, even Alpha variant is coming up. So, any particular variant which may be more dangerous to the pregnant and lactating mothers?
First, I would like to introduce myself. I am Dr. Anusha Reddy, obstetrician and gynecologist, and laparoscopic surgeon and infertility specialist at Medicover Hospital, Hyderabad. So, thanks for your warm welcome. And today is, this is breastfeeding week. So, there are many, as Dr. Ravneet has discussed, and as well as the Dr. Asta, breastfeeding is safe during COVID, as well as vaccination, and as per the Ministry of Health and WHO also. So coming to my question is like coming to the variants. So you all heard like there are many variants has come, like UK variant, and there is Brazilian variant and British variant, and there is Delta variant, and now it's coming up with the Delta plus variant. So most of them you have seen, like first when first wave came, none of the pregnant women got affected so severely. But when come to the second wave, you all have noticed that even pregnant women got affected severely, and they most of them needed an ICU admission also due to the breathlessness, and they had other complications like preterm delivery, and there were so many complications expected, and some even died of thromboembolisms. So we are not sure that which variant is causing this, because there is no studies like that. But what we observed through from the first wave to second wave, Delta variant is bit it's the symptoms are severe, and most of the patients has needed ICU admission, and no exception for the even for the mother. I mean, like pregnant women also. And yes, yeah, yes, yeah, yeah. So what I felt is that the symptoms might be little change. Initially they had only myalgia, and they might be they had only flu symptoms. But in the second wave, what we observed is like most of the women had to be, most of the pregnant women had to be ICU admission due to the severity of the Delta variant. Now there is something called Delta plus variant is coming, but we are not finding many cases. We need to observe how the outcome is going to be. That is a big challenge for us now. Maybe hopefully we don't see third wave, and that is what my observation is. Like there is nothing much difference between the variants, except that, but only the second wave we observed the Delta variant was little troublesome for the pregnant women. Other than that, rest of them are with mild symptoms only, because we have seen first wave when it has come, it was like absolutely they were like flu symptoms only. There was not big there are we have not observed many cases for ICU admission. That is what we have. It is our observation, and it needs more of studies, and we can't come to one conclusion right now. So it might need some time how it is going to be the Delta plus and variant and all. Yes, that's it.
Yeah.
Thank you.
Yeah. Thanks, Dr. Anusha. Yeah, I guess the Delta variant, anyways, in general, is also more infective. So therefore, the pregnant and lactating mothers are no different. So it's just like any general population how it is, right? All right. So thanks for that. And coming to Dr. Manisha here, and the question for Dr. Manisha is: did you come across a myth related to COVID and breastfeeding via a patient or public in general that you found weird and funny? We are getting all sorts of funny memes and funny things coming from the patient. So what was your experience around that? Dr. Manisha Kulkarni, please.
Hello everyone. Thank you for giving me this opportunity to be a part of this panel discussion. I would like to introduce myself. Myself, Dr. Manisha Kulkarni. I'm an obstetrician and gynecologist and infertility specialist working in Sahyadri Groups of Hospital, Pune. I have come across two common beliefs. The patients are calling us and they are asking the questions when they visit OPD. that should they win or stop breastfeeding their kid or newborn when they are opting for COVID vaccination. And another one is patients are asking, is there any correlation if after taking the COVID shot, the breast milk will get suppressed? And these are all foolish beliefs the patients are carrying, or general population is carrying, that they should not get vaccinated. And if they get vaccinated, it will affect their infants or breast milk supply. It is not at all true. Rather per se, as Ramneet ma'am has said, the breast milk uh, of the patients or the nursing mothers who had vaccinated with COVID shots will contain IgA and IgG antibodies in robust amount for 6 weeks almost after vaccination, and they will help their kids and infants to have the immunity by having the secretions or secretory antibodies in the breast milk. And no vaccine, any of the three, neither vaccine passes through breast milk directly, and it won't affect their kids. The second is the vaccination will reduce the breast milk supply. It is not at all true. It won't at all harm or hamper any production of milk from the mother. Yeah. You're not audible, sir.
Okay, yeah, I was saying, all sorts of, weird experiences around it. Anybody else want to share similar experiences in their practice? Dr. Ravina, maybe any pediatric related to COVID vaccine or something? You're mute, Dr. Ravina. Dr. Ravina, you're mute.
Yes, and Dr. Rohit, could you please repeat the question?
No, I just said, in your experience, have you got any such weird experiences related to patients talking about around the COVID vaccination and all? About around the feeding while the mother is positive. So I got, newborn babies, they are being covered with mask and they are not able to breathe because they wanted baby to be, protected. So all sorts of weird. So babies are not supposed to be masked, right? So because they're such narrow.
Yes.
So yeah, all
True.
sorts of
I mean,
experiences.
it was very amazing. One day I saw the baby with the shield and the thing. I mean, yes, and many mothers feel they cannot. Like many mothers opt for breastfeeding and opt for vaccination, but they stop breastfeeding after that, which is very dangerous. Again, I mean, mother can very safely take vaccination, and it is equally important to continue breastfeeding.
Yeah, in fact, they should be. It might actually help the baby, as you said.
Yes.
The antibodies will be transferred through that. All right, moving ahead.
Thank you.
I'll probably invite Dr. Manpreet now. Dr. Manpreet, question for you would be, how do the public policies on breastfeeding in India compare to other countries? Do you think there is something that needs to be added or changed?
Thank you so much for the question. Thank you. And first, I'd like to introduce myself. I am Dr. Manpreet Stodi, obstetrician gynecologist, Paras Hospitals, Gurgaon. And coming back to the question, since it's breastfeeding week and we must enforce, this is a time where we can actually, create some awareness. So we should talk about this. The public policies on breastfeeding in India as compared to other countries. So since our country, it lacks a little bit of economic stability, which is there in the foreign or the Western world countries, there is something known as empowering the parents to actually be able to breastfeed their children. That's one thing which is lacking in our country. Giving paternity leaves, giving maternity leaves, that remains an issue in our country, considering the economic status of the country. And whereas if you see the other world, Western world countries, they are quite empowered and they are doing that for their parents, and they're able to breastfeed because they have that kind of time and leave, which is absolutely not possible in our country. The other part is the code of marketing, which, the breast milk substitutes, which are being marketed in our country on such a large scale, the pharma companies and the other ways, the way we are marketing the breast milk substitute, that should be on a little decreased version. It should not be so much that the actual breast milk is it's replaced by the supplements. The other thing is the awareness that we can create by using the mass media regarding breastfeeding. It is absolutely lacking. I've hardly ever seen any advertisements, any awareness campaigns regarding breastfeeding. So for 1 week, yeah, we are there talking about breastfeeding, but on a usual note, not just the poor strata of the society, the rich, the influentials, they don't know the importance of breastfeeding. They don't know how important it is to actually breastfeed their child for complete 6 months and talk about 2 years of breastfeeding, which is actually the policy. It's very surprising for me sometimes when I see a very well-read, educated person and telling me, how can I breastfeed for 2 years? So that is the level of awareness regarding breastfeeding. And I feel our country can be empowered if we focus on these points. A simple message that is to be conveyed to our people, that how important it is and how it can change, the babies that we are raising. I strongly believe that there is a lot of communication gap, and this needs to be highlighted how important breastfeeding is for our country and our children. Thank you.
Yeah, very well said, Dr. Manpreet. Absolutely agree with you. I mean, on paper, I guess we have quite a good policy, but as far as the implementation is concerned, it's absolutely lacking. On paper, there are 6 months, leave, as you said, but it's not on the ground. It's not been implemented at all. In private sector, especially, mothers do their jobs. Yeah.
Also,
So
there's one more thing that I want to add to this. The other part of this is taking care of the mother. The additional support or whatever the diet or nutrition that she needs to continue her breastfeeding, to be well motivated to do that. All that part is also missing. So I strongly believe even in our postpartum counseling, if we see, so they are not so motivated and we try to motivate them. There are lactational counselors. That concept is coming, and I really strongly believe that there should be a lactational counselor who should be able to highlight these points, because when we are seeing our patients in our OPDs, we are mostly focusing on the clinical part. There's so much to see for an obstetrician as a practitioner. When you see a patient in the antenatal part and the postpartum part, there's so much to think about and look after. So the lactational part somewhere in most of our OPDs tend to get ignored, and the fact that she needs to take care of her nutrition to be able to do that for such a long time is also important. So that's where I believe the importance of lactational counselors come.
Yeah, absolutely. Yeah, we can go on and on this topic, right?
Yes.
So beautifully said. Anybody else has comments on this? I know everybody would want to talk on this.
I think I would like. Yes. I felt Olympics was one opportunity where globally this issue was raised, where it was like how the athlete mothers required the support in breastfeeding, and how they requested whether they can take their babies with them and they could continue breastfeeding. And similarly, like globally, this issue is getting raised, and I'm very hopeful that the way I think like protecting their working right, protecting it is the different areas where women working, especially like towards certain sector where the employees and employer they need to understand this is the time we need to support her the most, and this is the time her job security is most important. So I think this particular theme is supporting the mother, yes, protecting the breastfeeding, and we should focus this year. And again, we can go on and on about this topic, but the more and more awareness we raise about it, the better it is going to be. And it's nice to see now lactation counselors coming in. Most of private hospitals also have now lactation consultant, and it is like supporting them from antenatal time and taking through this journey for 2 years, and that is really important. We are going forward in terms of that. We are raising awareness, but I think at global level, at getting making breastfeeding in public a very norm, that is again very important, where women don't feel very shy and they are comfortable to feed, even if wherever they go, if there are lactation rooms where they can go and breastfeed, and they don't need to use a washroom to go and feed the baby.
Yeah, no, lot to be done. Okay, Dr. Abni, they still with us. Next question is for you. Apart from COVID, do you think there exists such myths and false facts related to breastfeeding in general? So leave aside COVID, any other general, myths and facts, false facts. So if you can highlight on that, Dr. Ravneet. You're on mute, Dr. Ravneet. You're on mute.
Yes.
Yeah.
So after delivery, day 1, we go to the mother and she says that the milk is not there and the baby need to be given something else, like either a supplement or pre-lacteal feed. That is the commonest myth. So this is for all the mothers who are listening today to the program, that first milk is called colostrum. It comes in very small quantity, only few drops, and that is good enough for the baby. Your baby requires very small quantity, and this milk is very, very high in immunity, provide excellent start to your baby. Giving any pre-lacteal feed, giving any supplement, if it is at this point, will expose your baby to the risk of infections. You will get lots of milk by day 3. Stay patient. 72 hours after delivery, you will get lot of milk, and that is when your baby requirement also become more. So please, the more you feed the baby, the more prolactin receptors you are stimulating in your breast, and you are going to have higher milk secretion later in life. First 2 days, unlimited feed, unlimited times. Always, it is always breastfeeding on demand. So your baby does not require anything else unless it is a medical indication. So be relaxed about that part, and not to have. This is one myth what I come across. Second myth, like second challenge what the mother come across, is that they all feel when they have to go back to work, this is the time for them to start supplement, and this is the time when it is the time to quit breastfeeding. So again, now mothers have options where they can express the breast milk, they can store the breast milk, you can freeze it up to 3 months. This milk can be given to the baby when in your absence, and when you are there, morning, evening, on holidays, remaining all the time, you can continue breastfeeding. Speak to your employer if you have any a way where you can have the time where you can come and feed the baby directly if the commute times are not longer. But at the same time, you have second option as express milk. So please again continue breastfeeding as per WHO recommendation for 6 months exclusive breastfeeding, and continue along with other complementary feed up to 2 years and beyond. So these two are very common questions I come across. Then there are many other questions. For example, they say that is right side milk more than left side, and surprisingly, this is a fact. Yes, I mean it may be to do with right sided. There are lots and lots of medical research studies about it, that why, but 75% of mothers have more milk on right side. It may be to do with the right handedness, where they are more comfortable holding the baby that side, and baby stimulate that side more and more milk. But at the same time, there are no conclusive evidence, but this is just the fact. So there are many interesting questions we all come across, and I think towards the end, if we have more time, we are going to discuss more and more myths about it. Thanks, Dr. Rohit. Thank you.
Yeah, okay. Thanks, Dr. Ravi. I guess Dr. Manisha has got a point to make about the previous question which we discussed. Dr. Manisha, would you want to say something?
Sir, about policy makers, there should be compulsory breastfeeding room, or like for comfortably breastfeeding the infant or kids in public places like multiplexes or malls, or even in corporates. There should be a breastfeeding comfortable room for the breastfeeding mothers to feed their babies. That's what I want to say.
Yeah, no,
Policy
absolutely. Yeah, it's there in the Western world, so it should be promoted here as well. Okay, next question going to Dr. Astha again. Dr. Astha, for you question is there a possible comorbidity for pregnant lactating mothers if they get infected by COVID? And are there any
Sorry, I couldn't hear the second part of the question.
Are there any possible complications?
complications?
Second part.
So what you're asking basically how COVID could affect the pregnancy, right? If I catch that correct.
Yeah.
So, so there are a lot of observations that we've made, but whatever data we have till now has shown that pregnant women are not more vulnerable to catch COVID as compared to the rest of the population. And as we were mentioning about the Delta variant also, so that also was more prevalent, the vulnerable group for the older people and not the pregnant women. So that is one reassuring thing. And out of all the women who get COVID, 2/3 will be asymptomatic, which is like the general population, and only 10% will need hospital admission. So the only thing which is of a higher risk is that if a pregnant woman gets COVID and needs a hospital admission, then her chances of ICU admission are much higher, and her chances of preterm birth are increased up to 2 to 3 times. So, so these are the two things which have been proven by all the studies. And so, if a woman catches COVID in the first or the second trimester, it is less likely to affect her or the baby. There are no studies showing a congenital malformation. There are no studies showing that there is an increased chance of a miscarriage. So no proven theories, but yeah, in observational, like if I talk about the last wave, a lot of my patients who had COVID in pregnancy did have oligoamnios, they did have growth restriction, but there have not been enough studies to document it that it was a statistically significant number. So this is what, so the two things which have been increased are the ICU admissions and the preterm births.
Yeah, that's correct. I guess.
That's correct. I guess
Chances of infection are probably the same, but then because the pregnancy being a little, immunosuppressive state, maybe the manifestations are a little more. All right, moving on. I'd like to invite Dr. excuse me, Dr. Anusha, maybe. Dr. Anusha, the question for you would be, what steps can be taken by the policy makers? It's actually the continuation of the question which we discussed before. So what steps the policymakers can take to encourage and empower breastfeeding?
Yes. As all discussed, actually, policymakers can, they can arrange for antenatal classes for the women to tell the importance of breastfeeding and how the immunoglobulins will be transferred from the mother to the fetus. So the importance of breastfeeding and the chances that the fetus, like newborn, they are less prone for the infections due to the immunoglobulins or whatever antibodies that is being transferred from the milk, maternal milk to the newborn. So they have to follow some strict policies, like like we discussed earlier, and they should give proper maternity leaves. For them, they have to make a policy that it's not that for namesake they give and they ask them to join again within 3 months. Not like that. Proper 6 months maternity leave should be given, so that later part of her life and later part of the mother will decide how to manage both work as well as the breastfeeding. And also they should take antenatal classes as well as lactational classes. And lactational classes are very important, and how to breastfeed, how many hours once they have to breastfeed, and there should be some guidelines for that, as well as we discussed they should have proper lactation rooms, breastfeeding rooms everywhere. They come to hospital, they should have some breastfeeding room, or if they go to some mall or shopping mall or any place, public places or railway stations, wherever, they should have the breastfeeding room, so that that inconvenience won't be there for the mother particularly. and that is what I feel. The changes and the family support is more important also, because once from the husband as well as the family members, well, she's working as well as she's breastfeeding, and they need to, you know, and banks. And I want to talk about the we hardly see any banks, and that is milk storage banks I'm talking about. That also has to be taken care. That's it.
No,
Thank
absolutely.
you.
Yeah. So I guess
Should
policy provide some budget particularly for the breastfeeding promotion, right? They need to understand it's not an expense; it's an investment. Actually, considering so many advantages to the babies in long run, less number of infections, and parents missing out on their jobs. So all these they need to understand. Long term effects. Advantages to mother. So many advantages to mother. Right, number of cancers going down. So this needs to, the policymakers have to take all this into account and then promote breastfeeding and have some budget for that. Then only they'll be able to provide those leaves of 6 months and so on. And then having breastfeeding areas dedicated. So all these policymakers have to understand. We can always talk, but unless it is implemented on a mass scale, it will not percolate into the masses. All right, moving ahead.
If I could just add a point, Dr. Rohit. Yeah, so last year, because of COVID, I think the healthcare sector was also very overburdened, and that's why actually the breastfeeding rates fell, because the healthcare workers did not have time enough to motivate and dedicatedly assist and help women in breastfeeding. And also all the Anganwadi workers and everybody was more into the disaster management thing, and the breastfeeding was ignored. So I think as you said, the budgeting should be more towards there should be an official budget for breastfeeding, and also for our a baby friendly hospital initiative, and also they have to be really implemented on a better scale.
Yeah, no, true. Yeah, absolutely agree on that. Yeah, so disaster management of course comes first, but then this has to go side by side because they are interlinked. All right, moving ahead. Next question, Dr. Manisha. Why do you think it's important to recognize breastfeeding and facilitating its importance, specifically in the Indian population? Partly, I guess we have already discussed, but if you can further highlight on that, Dr. Manisha, please.
Yes, as we all know, breastfeeding is a cornerstone of infant and young child survival, nutrition, development, and also maternal health. It is a cornerstone, and that's why the theme of this breastfeeding week 2021 is protect breastfeeding. It is a shared responsibility, and to be successful, what should be done is we should support breastfeeding mothers, and they should be protected from influence of baby food industry, and they should be supported at work and public places. And as we see across our country, it is the main concern is socio-economic. It is very easy and better to feed a nursing mother with 300 to 400 calories per, and to feed a infant with infant feeding formula. It is cost effective. Breastfeeding is a long and short-term health of society in a large scale. It will and our sustainable developmental goals 2030 is to decrease neonatal mortality to 12 per thousand, and under 5 mortality to 5 per 25 per thousand. And the main initial step towards it is early initiation of breastfeeding, which will help in building the immunity of the younger age group. And it will help to sustain the good immunity level in our country. It is always better when economic constraints are there, and it is hygienically also better to breastfeed a baby than to clean the utensils required for formula feeding the baby. Thank you.
Yeah. Okay. Thanks. Yeah. So ours is a developing nation. So breastfeeding is probably one of the most cost-effective public health measures we can focus on, right? Breastfeed care is not the way to go anyway. So especially in our country, it's extremely important. Just like, the antenatal steroids, clean hygienic water, breastfeeding actually stands on top of all these public measures to decrease the burden of disease in a country like ours. So absolutely. All right,
It's
moving ahead.
freely available. It's
Yeah,
cheap and freely available actually.
yeah,
It
absolutely.
decreases the
Nothing
burden
better.
of the
Yeah.
family also.
Yeah, true. All right, Dr. Manpreet, would you like to answer the next question? The question for you is, you come across and meet pregnant or lactating women and their families on a daily basis. Do you think there is a lack of understanding and awareness amongst Indian parents regarding correct breastfeeding practices?
Okay, thank you for the question. And absolutely, I think we have discussed this by far in the discussion so much that how the awareness is affected in our country and in general, the awareness. A very practical point that I have picked in past few sessions with patients is that they partially understand, or rather don't understand, what actually exclusive breastfeeding means. So sometimes they take a very wrong message. They feed the child, they breastfeed the child, and then, of course, there's feed on demand in the first few days. And parents don't understand. And then the elderly in the house generally have a notion that the baby is hungry. So they give them top feeds. So the basic idea of exclusive breastfeeding is absolutely killed over there. They just don't, there is this gap. They don't understand that when we are saying exclusive breastfeeding means that should be enough for the infant. And if it is not enough, your pediatrician or your doctor will guide you to top feed, or there are signs that we can explain that the baby is not passing urine or there is other problem, then you should be thinking about top feed. So this idea, there is no clarity about exclusive breastfeeding. There is completely, this is among the affluential families, be it the richer, the poor, the masses, everybody has this notion that the baby is hungry, the mother's feed is not enough, you need to give top feed. This is the most common thing that I have come across by far. The other thing is that because the mother is not guided correctly, so positional errors, back pains, these things leads to, discontinuing their breastfeeding practices. These are the things which we can actually guide them, that these are very little hacks, I would say, which will help them to continue breastfeed for a longer time and which will provide a better immunity and everything for the child. Third thing that I feel, so I'll give you very practical examples. I work in a government setup, I'm working in a private setup. I face this issue everywhere. So in a private setup, let's start because that sounds more decent in this discussion right now. People after normal delivery or even after C-section. So breastfeeding in the first hour of the pregnancy, that should be actually, that should be really stressed upon. That's not done. Sometimes because the mother is really tired, okay, understood. The mother has had a C-section, so mother is not ready for that kind of breastfeeding. But WHO, UNICEF, they have put a lot of stress on the first hour of breastfeeding, that when the baby is just born, that first hour, you should actually initiate the first feed. And they have collected data over past 5 years, and they have found only 40 to 44% of the infants are fed in the first hour of their delivery. And I'll share a very funny example with you. This was in a government hospital, I'll not name it. So after delivery, in the first 1 hour, because the mother was tired and she was giving chai biscuit, I mean, that's a routine practice in government hospitals. You offer them tea biscuit. So a little bit of tea was also offered to the newborn. The baby will like it because abhi feed to aayega nahi, so let's just give a little bit of tea. So I think these are these little small myths which are creating gaps, and that leads to a bigger problem. So these little things solved in person with the patient after counseling or otherwise during your antenatal counseling, also the family members. I have seen women going into depression just because the family members are not able to understand that the babies cry. And they don't just cry for the feed, they cry for other reasons. They might have passed urine, they might be wet, they might not be comfortable in a certain position. But all the pressure comes down to the mother. She has to feed the baby. And if she's not ready to breastfeed just because she's just fed her about an hour back, the next pressure is then you give the top feed. So there comes in action. The exclusive breastfeeding is absolutely scrapped. A lot of families don't understand this point. So I really have to stress upon, no, this is how it works. The baby will cry and you will let it be, and you will have to look for other things. There might be other reasons for the baby to cry. I think these counselings do happen in the pediatrics room, sir, with you, but I have seen it quite commonly, and this is a bigger problem I feel, because the educated lot, the uneducated lot, the masses, everybody have a common belief that the baby is hungry and breast milk is not enough for the baby.
Okay, calm down, Manpreet. Good. I guess we all should be as emotional about it, and then only the promotion will happen. Yeah. So I guess the baby, chubby baby, seen on the television, and then suddenly a box of formula milk popping up. That image is all the mothers are carrying. They want their babies like that. All that also need to stop at the same time. And I don't blame mothers or the families. I actually blame ourselves, the doctors. A, the awareness amongst doctors is less. B, uh, the kind of counseling which mothers and parents need. I don't think, if we can, we have conviction in our own minds, then only we can convince others. And then parents definitely want best for their kids. If we can convince them that it's important for them to breastfeed, I'm sure they will understand that. It's the lack of counseling sessions that we don't go through enough, that this leads to the gap. Anybody else has got any comments on that? They're most welcome. Yeah, Dr. Ravneet wants to say. Yeah. Yeah, go ahead, Dr. Ravneet.
Yeah, Dr. Rohit, over here, I will like to stress the need of hospital policy. Each hospital, if they have good hospital policy to protect the breastfeeding, I do not see this problem happening. When we have hospital policy where it states that first feed should be started as soon as possible after birth, and when that practice is followed, these problems automatically get solved. When we have the hospital policy for the use of formula, where you need to get a consent form signed by the parent as well as the treating pediatrician or neonatologist, as well as specify the reason that why formula is given for the baby, where it is given the medical indication, because of course crying baby cannot be the indication of giving the formula. So automatically these practices come automatically in place. So I think that we must stress the need of having each hospital having a good their own hospital policy, and as many possible hospital should be baby friendly hospitals, whether it is government sector or private sector.
Yeah, no, absolutely. I mean, hospital policy is a must, as you rightly said. Each hospital have to have a written policy and needs to be followed up stringently. Okay, I guess we have come to an end to our discussion here, unless anybody else wants to make a point on this topic. And thanks to Voice of Healthcare also for providing this platform. And I'm sure each of us have planned our breastfeeding week celebrations for the coming week. We are in the in the middle of developing all those poster competitions and all. So we have few sessions lined up for the nursing staff or the mothers. We have also planned for the pictures being collected for the babies in their positions, asking mothers, so to create all this awareness. That's what we are doing in our hospital. I'm sure you guys are also doing similar stuff. All right. So I guess, can we finish here? We can just stop. Any ending comments anybody wants to make? So Manpreet wants to say.
I think I said enough. You told me to calm down.
You can't calm down. Either you are emotional or just quiet. Huh? No, good. It was a good discussion.
I think yes, I have one question from all this thing, because as I deal with more of a corporate sector, and I'm very fortunate that Manipal Hospital started. We have the hospital policy where every newborn is seen by lactation consultant, and there is a constant support of the in NICU, so that we try to give only breast milk to all the newborn, and it is mandatory for every single newborn over there to be this thing it. So I feel if the gynecologist and pediatricians, if they are overworked with this thing, a lactation consultant can really help in these situations, where if we don't have that much of time, because I completely understand that pediatrician has so many other things to be taken care. Same thing, gynecologist and there is one person exclusively role of lactation nurses, lactation consultant, lactation physicians, where they work beautifully, and we definitely can improve our rates of breastfeeding, especially first 1 hour of birth. Post.
Yeah, no, absolutely agree on that. Okay, I
Thank
guess
you.
we've come to an end
Thanks
of
very
the
much.
session. And thanks a lot to all the panelists for such a nice, enlightening discussion. And I guess we'll wind up here.
So, hello and welcome to the Breastfeeding Conclave of 2021. The global theme for Breastfeeding Week this year is protecting breastfeeding, and the focus is on on sharing the responsibility of breastfeeding and not just leaving it onto the woman. And that is what thanks to Voice of Healthcare, we have this wonderful Breastfeeding Week being organized. And I'm your host for this session, with a very eminent guest. But before we get there, I'd like to take this opportunity to thank MCure Pharmaceuticals to sponsor the event. And thanks to them, this is actually being possible. Very quick introduction to who I am. My name is Rashmi Pucha. I am the founder of Ainari. Ainari is a women's health platform, and we focus on healing hormones naturally, via diet and fasting. So, women's health is a very close, topic for me. Menstrual cycles and breastfeeding, unfortunately, are topics which are not being spoken about openly because of taboos, cultural taboos in the society. And I'm very, very excited to be here today and talking to a very eminent person on this topic. And with that, I'd like to introduce our speaker for today. She's a very, like I said, a very well-known gynecologist and a laparoscopic surgeon. She's also the president of the Federation of Obstetric and Gynecological Society of India. Please join me in welcoming Dr. Shanta Kumari. Welcome to the show, Dr. Shanta. It's a pleasure to have you here. And we would love to know a little bit more about you. So if you could just share a little bit more, I think it will be really, really nice.
Thank you, Rashmi. Hello, everyone. I am Dr. Shanta Kumari. I'm from Hyderabad. I'm the president of Foxy. Foxy is the Federation of Obstetrics and Gynecological Societies of India. We are a 37,000 strong body of gynecologists. And we have about 262 societies in the countries across the length and breadth of the country. All of them are our members. And our commitment is to women's health. And this year, the Foxy theme in my presidency is Foxy for all, always, and Dhira, stop violence against women. Now, what do you mean by saying Foxy for all, always? See, Foxy for every mother to be able to save herself, to reduce the preventable maternal morbidity and mortality so that we can reach the SDG goals. Foxy for every mother, so that she will be able to breastfeed her child so that the baby will be healthy and grow up to a strong adult. Foxy for all Foxians, so that we can practice with protocols and with dignity, and we would be able to take forward the right messages to our patients. And of course, Foxy for every woman with Dhira, which is an initiative to say no to violence against women. So friends, with this theme of Foxy for all always, we have come this year, and that's how we are here today with Rashmi to talk about the Breastfeeding Awareness Week. You all must be knowing about this World Breastfeeding Awareness Week.
Yes, ma'am. And with that, I think we're going to jump to some questions because I know you're tight on time, and I'm sure our audience is also waiting for the questions to, to kind of get answers from you on so many issues. So the first question, why do you think it's important to recognize breastfeeding and facilitating its importance, especially in the Indian context?
Yeah, that's a very interesting question, Rashmi. In fact, why are we talking is because the World Breastfeeding Week is celebrated every year from the 1st to the 7th of August. And that's the reason we are here to just discuss about everything about breastfeeding. Ironically, actually, we are talking about breastfeeding. In fact, when you look at human beings are the only, I think, live beings on the earth who are actually looking at something other than breastfeeding. We don't find any other living organism on the face of earth who will try to feed the baby with any other feed, right? So I think that is the reason why now we have to focus on what is a normal physiological aspect. So that is the reason we decided that it's time that we talk about breastfeeding. And this year, as you rightly mentioned, the theme is Protect Breastfeeding, a Shared Responsibility. So this is the theme of the year, and that's the reason we got together to talk about this breastfeeding and to bring about more awareness among the new moms who are going to take care of their babies.
Fantastic. I think you said it. I think we're the only species on this planet who are so reluctant to talk about it, who are looking at other options. And we're so glad that organizations like Foxy actually take up some of these causes. So, Dr. Shanta, how do you think associations like Foxy, how do they play a role in educating and empowering the practice of breastfeeding at large? And I'd like to add just one more question to this one. Are there any specific policies or programs that have been or are being initiated by Foxy to address the importance of on this issue?
Yeah. Thank you, Rashmi. We at Foxy at the national level, we have some committees. We have about 27 committees which work under the Foxy leadership. And one of the committees is the Foxy Breast Committee. This committee actually works towards enhancing the breastfeeding practices in the country and trying to raise the awareness among our patients and women and the society at large. So this is an ongoing project. Over the decades, we have been having this committee, which has been led by able Foxy members, and they actually work at all the society levels and try to increase the awareness of breastfeeding. And we as an organization, now we are looking at this breastfeeding week, 1st to 7th August. So what we have done is we are doing the program of Lactation 2021, and which will go to culminate in a program on Lactocon on the 7th of August. So the week-long celebrations, we have actually called all our societies to participate in this week-long programs. And we have requested the president secretaries in all our 262 societies to come forward and tell the members to participate in various public awareness campaigns. They can do it at their clinics, at their hospitals, or they can do in outside on the digital platform. They can do media shows. They can do write-ups in the newspapers, television shows, every possible medium, to connect to the general public. That shows the commitment of Foxians towards women's health and breastfeeding. That is our responsibility. So when you're talking about protect breastfeeding, that means it is something which every one of us has to nurture, the breastfeeding. And why are we saying it's a shared responsibility? It is not only the responsibility of the mother towards her baby, but it is the responsibility of the family as a whole. And the responsibility of every doctor, every healthcare provider, be it a NM or a nurse or a midwife, whoever is taking care of the mother during the pregnancy and delivery. And along with them, it's the responsibility of each and every one of us in the society. If a mother is going somewhere with a baby, any place, any public place or any other place, she should be given some space where she will have the privacy to feed the baby, where she'll be able to take care of the baby's need. So that is where the society's responsibility comes. And to show and reinforce that it is everyone's responsibility to see that every baby has the right to the breastfeeding and breast milk, which is the best milk.
That's very beautifully said. I think I so agree. You know, as a woman, of course, my daughter is 14 now, but you know, I've gone through it, and it's been, let's say, it's not been a very comfortable journey so many times, right? And especially in public places, at workplaces, it does become challenging. Dr. Shanta, I have one question. You know, I had asked you earlier as well. At the policy level, are there any influences that are being made by organizations such as yours? Are we doing something? Yeah.
We have our policy where we say that we encourage breastfeeding. That's the reason we are doing this celebration. And then we expect all our members, Foxians, the 37,000 plus obstetricians, gynecologists, to partner with us to encourage this breastfeeding. And you know, when you look at the government, then you look at the UNICEF and so many organizations who are working towards this enhancing the breastfeeding. And when you look at the data, it is rather not very nice, you know, to notice that when you look at the South Asian countries, India is having only 44% of women who are actually initiating breastfeeding within 1 hour of the birth of the baby. So we are lagging behind. So we want to encourage it. We want to increase the number to the maximum so that every mother will initiate breastfeeding within 1 hour of the birth of the baby. So that will go in a long way to establish faster breastfeeding and then the what the baby needs. So that's what we are encouraging.
Nice. Asking you a follow-up question on what you just said. So, if only 40% are, are breastfeeding within the first hour, what do you think is the main reason why the remaining are unable to do it or not choosing not to do it for that matter? Would love to understand this. Yeah.
We are talking about the initiation of first hour. It doesn't mean that the rest 56% are not breastfeeding. It is the start initiation of breastfeeding, which is delayed. Okay. So that you have to get me right. And then there are so many myths, you know, some people have the feeling that the first milk, which is that colostrum, we call it, that's not good. It's thick and the baby cannot digest. These are some myths and fancies which women hear from the neighbors and all the people whom they ought not to hear from. So these are the myths. And sometimes, you know, say the baby is born, if the mother had an operative delivery, the mother is very tired, or, you know, or sometimes if the baby had some other issues. So those could be some of the reasons why the delay in breastfeeding. So we encourage all the obstetricians and all the neonatologists and pediatricians who are attending the deliveries to see that the initiation of breastfeeding is as soon as possible, even if it is an operative delivery.
That's, I think that's a fantastic point that you mentioned, because I had not understood it, from a layman's perspective. I think it makes things so much clearer. Is there any message that you'd like to give to parents, reinforcing what you just said, that why it's so important to do it in the first hour and even beyond that? Because we still, unfortunately, it's not as, like, every baby, like you said, should be able to, get that milk, right? It's gold. And is there any message that you'd like to share with the parents?
Yes. You know, it is not something which is beneficial to the baby. You know, as soon as the baby starts breastfeeding, the suckling reflex will cause the release of oxytocin hormone. And this hormone will act on the uterus and make it contract. So that will prevent the excessive bleeding after delivery. So you all must have heard about postpartum hemorrhage. That is a dreadful condition which is one of the leading causes of maternal mortality and morbidity in our country. So early initiation of breastfeeding will also reduce the amount of blood loss. And not only that, what will happen is the breastfeeding will reduce the amount of blood loss, and anemia, which is so rampant in our country, that also gets reduced. So that is also one of the important aspects for for us to actually initiate breastfeeding as soon as possible.
Fantastic. Ma'am, last question. Do you think events or discussions like these actually contribute, to the international drive of, breastfeeding awareness? Or is it something which lasts for that 1 week? And then I understand that organizations such as yours do it. I get that. But in terms of, how it's spoken about in public places, in terms of just general awareness about talking about it more than like
Yes.
not knowing about it. So how do you think, what's your take on that one?
Rashmi, what I have observed, every year this World Breastfeeding Week is being organized, and then so many programs are going on. But this year I have seen a renewed interest, more interest from various partners. We have seen all the stakeholders of women's health, all the NGOs, all the lot of mothers groups, and lot of other partners. They're all very keen to actually increase this message, and to see that more number of babies are, or I would say all babies should be breastfed. That's their right. And we do understand that the breastfeeding is the one way that the first few days milk has lot of antibodies along with the nutritive value. And these antibodies, it's like, the first vaccine the baby receives. Now, the past 1 year, everyone has been talking about immunity, vaccines, and then infections. So I think no better time than this for us to emphasize on the need of breastfeeding for babies. That's the reason why we need to focus on breastfeeding.
Absolutely. And I think, like you said, immunity is something that everyone's been talking about in the last 1 year, and antibody release, immunity, gut microbiome itself, right? I mean, there's so much positivity to breastfeeding. And I'm very glad to be able to, have spoken with you and had the opportunity to actually, ask these questions on behalf of our audience. And I have no further questions. If there's anything that you'd like to,
I would like to add one thing.
Please
Every mother and father expect that the baby to be the most intelligent baby on the earth. And so for those moms and dads, I would like to tell, there are some studies which have shown that the breastfed babies are more intelligent than the non-breastfed babies. So if you want your baby to be more stronger, and they're actually less chance of infection, less chance of hypertension, less chance of obesity, less chance of lot of cardiac diseases when they grow up. So if you want your baby to grow up to be a very intelligent adult with absolutely no health problems, then it's your responsibility that you breastfeed your baby. So this is my message.
Oh, this is a wonderful message. I think that will reinforce all the IIT, IIM exams that we want to write, at the end of the, at the end of many, many years. Thank you so much, ma'am. It was lovely speaking with you. And with that, I just on a parting note, thank you so much to Voice of Healthcare for organizing this, and once again to the sponsors, MPR Pharmaceuticals. It was lovely having you all. And if there are any questions, please go ahead and post them in the comments, and we'll make sure to respond back to them. Thank you.